How to involve healthcare, physical activity in the healthcare system. I believe this is a team approach to getting our patients more active. A lot of people think it's a responsibility of just the physician, but I think it involves every person in the hospital system. From the minute you walk into the waiting room, the atmosphere, do they have posters? Are they promoting a healthy physical activity environment? That first person you meet, is that a person that embraces physical activity, that's active, that wants to promote it? Maybe they're the ones asking you about your physical activity levels. Then you deal with the nurses. Are they trained to talk about physical activity? Are they skilled? Are they helping with the process? And then for the physician, obviously a very key component, we need our physicians giving that positive message, that encouragement. And then when they leave the physician, is there someone to follow up with the prescription, with the referral, to help that patient connect? So integrating physical activity is really, it's the job of the entire healthcare team. Even the administrators, they're responsible for helping make sure that the whole team does everything properly. And where we see this happening correctly in different places in the world, it's highly successful. But it needs to be a team-based approach where everyone's working together on the same strategy to promote it. I think one of the most important parts we're realizing is that there's got to be a connection to resources outside of the hospital. So it's not enough to tell a patient to be active or to write on a piece of paper, but we need to hand them off to exercise professionals or to community programs where they can be physically active and receive guidance and support and not just have to do it on their own. Well, we have small examples of success all over. We have several health systems in the US doing this, where they're referring their patients. They do the whole system in the hospital, but then they refer their patients to like YMCAs, where there's special programs for patients with diabetes or cardiovascular disease. In New Zealand, they write green prescriptions and connect them to local sports centers. In Ireland, we have some guests here that are doing very active programs within the government and the health system. So this is a growing field. We're still very early, we're still learning, trying to figure out what works and what doesn't. But overall, we're having small successes all over the world. And I think in the next 5 years, we'll have a lot more knowledge and information on this. So we're not looking for exercise to be a cure. We would like exercise to be a prevention. You know, we want to identify people before they have a disease. We want to get people to be more physically active earlier in their lifestyle so they never even get to the point of having a disease. So that means identifying people not meeting the physical activity guidelines and getting them active early in life before it's later and they have problems with osteoporosis or heart disease. Because sometimes these diseases aren't curable, they cannot be reversed. And we don't want to see that. We want to do prevention first rather than moving down and do treatment down the road.